certainly as a Black woman who have given birth to 3 people, human beings, and adopted one, our birthing experiences are not great. Even when you have, resources and care, there are real challenges. And as we looked at the data and we really looked at our own experiences, one of the things that we want to do is make New York City the safest, best place for a Black woman to have a baby in the country. And we cannot do that without a collective effort, without community, without philanthropy, and we're really hoping that this gathering is a step on the journey.
We know what it takes to build wraparound services. We know what it takes to build stress-free neighborhoods. We know what it takes to ensure that every birthing person has access to a doula, a midwife, to all the care that she believes she needs and that her providers believe that she needs. And yet we aren't yet doing those things. And I find this especially challenging here in 2024 during Women's History Month because we have continually failed to live up to, I think, the promise of what it should mean to live here in the greatest place on earth. And when we know that 75% of maternal deaths in Black women are preventable, it's just unacceptable that we aren't moving with urgency and purpose and deliberation. While certainly kind of cutting maternal mortality by 10% is an ambitious but hopefully realizable goal, it can only be kind of the first mile marker. It cannot be the end state. We cannot mistake progress for success. And so we need the funding to hopefully prove to ourselves what is possible, but also then to set the next horizon of what we know we need to do to ensure that every person in this city can feel safe and supported and cared for, particularly our birthing people and our youngest New Yorkers.
I heard that there was an $11 million kind of number mentioned earlier. I was wondering if someone could talk a little bit about the funding sources for this. What do you envision? Where do you envision that coming from as far as like the proportion of public to private sources, that kind of thing?
Thank you so much for the question and for the early excitement about fundraising. So, I think the 11 million, as I think might have been shared earlier, is really kind of phase 1 of getting all 4 pillars started. Some examples of where some funding has already happened. A lot has come through city tax dollars, so thank you, to the residents of New York City for contributing to the expansion and the growth of these programs. Some of these have already come from foundation contributions, from state and federal investments, and so today what we're really talking about is how do we continue to fill the gap in order to move ourselves forward to get the 11 million and then to continue growing investments in many spaces. In other parts of the country, particularly in the South, we're seeing these sort of collective groups of fundraisers and donors and foundations coming together, raising the large amount of funds that are required. And so we're hoping that we will continue in partnership with the Fund for Public Health to be able to do that in New York City and model what it looks like to fill the gap with philanthropic contributions.
How people are treated at birth, into life, and into educational and professional environments ready to start their own families really, really matters. These experiences matter. How we name and address racism in care matters. And how we align ourselves behind a common vision, a common agenda to save lives matters. We must all agree that the status quo is unacceptable and we must marshal our resources to change it, and we can't do it without you. It will take all of us together across industries, agencies, communities, sharing ideas and resources to create healthier and safer pregnancies and childbirth for all. We need the philanthropic sector, a core pillar of our civic infrastructure, to help with this partnership, innovation, partnership, and resources and support. They always say, ask for advice, get money, ask for money, get advice. But in this case, we need all of it. Right? We need all of it. We need you here as partners at the table. We need you here as partners at the table, and that's how we invite you into this space.